Ma'am, I'm not able to share the slide of the human right because as soon as I'm sharing that screen, it is just taking me off. I'll try once again.
Make sure to. Do you want me to share that slide on the theme?
Yeah, you can, ma'am, you can.
I'll just try. Is it visible?
Yes, yes.
Over to you, Bharti.
Yeah. Ma'am, I've disabled the waiting room now, sir, because the number of participants are less. As of now, we have only 26, but we have video recording it so that it will be placed on the YouTube at 1 o'clock. Kashinaji, you can look into the video later on if you're not able to hear. We are not going to respond to any of your voice internet issues over here. Good morning, distinguished guests. Today being World Health Day, it is celebrated on 7th April every year, as you know. I think we need to mute, please. Jaivir, please look into it. Prashant, please look into it. Mute everybody who is speaking. World Health Day is celebrated on 7th April every year to mark the anniversary of the founding of WHO in 1948. Each year, a theme is selected to highlight a priority area of public health concerning to the world. This year, 2024, marks the 76th anniversary of WHO, and as a part of celebration, WHO has chosen My Health, My Right as a theme of World Health Day 2024, which focuses on the fundamental human right, access to quality health care, education, and information. For instance, there is no right to health in the Indian Constitution, but the Supreme Court of India has interpreted the Constitution's article on the protection of life and personal liberty so as to include access to healthcare into the article's scope. Ayushman Bharat, also known as the National Health Protection Mission, is a significant initiative by the Government of India. I request Brigadier Venkat Narayan, Officer on Special Duty to Honorable Member Niti Aayog. He's a doctor with specialty of pediatrics, MD in pediatrics. He has a previous key appointments as Professor of Pediatrics in MUHS and WBHS universities. Previously, he's HOD of Departments of Pediatrics and Command Hospitals, Pune. And he's a tutor, facilitator of neonatal online teaching in Europe. In 2009-11, an online neonatal teaching program in India during 12 and 15. He has 50 plus national and international peer-reviewed papers. He's also awarded GOC in Command Commendation in 2018 and Chief of Army Staff Commendation in 2020. And areas of key work that the Niti Aayog is, he has done a lot of various projects over here, like national level policy works pertaining to pandemic preparedness planning, vaccination, medical education, holistic emergency and trauma care services, new M system, antimicrobial resistance, One Health, HRH workforce, early childhood, etc. So, sir has a big CV, but we have just shortened it. Thank you, sir, for coming to address the participants over here. Now, I request on the above context to please address the participants.
Thank you so much, ma'am. I hope I'm audible.
Yes, sir.
Yeah. At the outset, I'd like to thank you very much for making me a part of this very important discussion. My salutations to the nursing professional and fraternity. I've been closely associated with the nursing fraternity right from my early days of profession till date. And I've seen various aspects of nursing professionals. Just want to give an overview of India's progress over the last 10 years or so as regard to the health aspects, which furthers the present theme of My Health, My Right. India's poverty index has reduced from 29% to 15%. Multiple levels of healthcare deliverables actually reaching people have been initiated. For example, the e-Sanjeevani, which is the teleconsultation, which has got no barriers for any people to access, has already done 223 million consultations. 500 million ABA IDs have been generated, which gives the people an right and access to health. Doctor population ratio has crossed more than 1:1,000, this WHO norms, though there is a lot to be done still on the nursing front. The nursing plus midwifery ratio is approximately 2 per thousand today. It has to reach 3 per thousand. The nursing ratio is 1.45. It has to reach 2.75. At the primary healthcare level, Arogya Mandirs or Ayushman Bharat Health and Wellness Centers, around 1,69,000 have been established as on date. They provide huge amount of connect with the people, 14 diagnostic tests in sub-centers, 63 in primary health centers, around 105 medicines are delivered in sub-centers and 172 plus in primary health centers, so on and so forth. It provides healthcare in packages. Similarly, Ayushman Bharat PMJ scheme has covered one of the world's largest universal health coverage with more than 1,900 packages, and government has spent more than 86,000 crores. But the most important point I want to make today is that the nursing professional has got a connect right from the grassroots primary healthcare level to the tertiary care level. Be it at the level of CHO, wherein they are at the Arogya Mandirs, they're providing cares and packages. Mental health, where they're giving important counselors. Palliative care, geriatric care, critical care, emergency care. And you name it, and we all know that nursing professionals are at the helm of affairs and doing a great job. So why is this today's context important? My health, my right. We're living in a very different world as on date. And as years progress, we're going to meet more disasters, more disease, more pandemics, more conflicts. It is fundamental right for everyone to have health, so it reaches everyone, everywhere. There should be right to education and information, good nutrition, decent work condition, freedom from discrimination, so on and so forth. I think WHO has rightly recognized these aspects. So at one point where India is making huge progress, other point, there are huge challenges. And the third point, the nursing fraternity has done significant contribution and has got a very important big role to play. In this background, I'd like to highlight two important aspects as far as the nursing profession is concerned. One is the multiple reforms which the government has undertaken. And second is the challenges and the present day needs. Now, these points are my personal points, may not necessarily represent my organization where I'm representing today. And we please take it in that spirit so that we can take the related issues forward and reach to a logical conclusion. Concerning reforms, we all know that the nursing seats have increased tremendously over a period of time, from 25% to 35% hike over the last couple of years. The Nursing and Midwifery Commission has already come. It's on the annual, I think it's going to be launched in full swing soon. Newer nursing curriculums such as nurse practitioner courses for multiple domains, critical care, community health, etc., are in the process of being launched. Competency-based education, focus on soft skills, post basic diploma, new courses, certificate courses, increase in stipend for the nursing cadets, facilitating nurses to reach overseas in some countries like Singapore, UK, Japan. All these have happened in a very big way over the last couple of years. But the most important challenge, which I keep hearing, the noises I keep hearing, and also it has been somewhat documented, is that nurses still face a lot of issues in the workplace. They require facilitation. Nurses require induction programs. The issues of security, working hours, recognition related to maternity leave, childcare leave, equitable opportunity for pursuing higher education, recognition, remuneration as per qualification, restructuring of cadre. When I discuss with nurses in multiple domains, for example, in the education stream, there are still issues about vacancies of faculties. At one side, we are definitely increasing the nursing colleges and nursing seats. Other side is the quality education. Government is looking into putting in accreditation norms for bringing in quality. But we require real issues to be projected from the grassroots. What I heard from people is that there are still issues with vacancies about nursing faculty, issues regarding cadre restructuring, workplace issues. What are the job roles, define job roles for a BSc vis-a-vis an MSc nurse in a particular hospital? Again, there are issues regarding nurses from the private sector, issues being projected by civil society organizations, so on and so forth. So keeping this view in mind and considering the fact that government is very sensitive to the call of nurses and has got a renewed focus in the nursing stream, I think this is the right time for all the stakeholders of nurses to come together. Leave aside your little organizational differences. I'm sure there are multiple nursing organizations, INC, TNI, private sector, CSO groups. I don't know, there will be so on and so forth. But my only request is nurses together should come forward, put across the strengths. First of all, articulate what they have contributed to the nation, what they can contribute in future. More importantly, acknowledge what the government is doing for them. And then put up your challenges cohesively. Can we all come together, put your challenges cohesively? There are definitely people in the government sector who want to sort out these issues, but the only thing is we don't hear a single voice. I'm being very frank with you today. Voices come in different tones, and government is at a loss as to what to do. My only request is put aside your differences, come together, put across your issues, and come with probable solutions, optimal solutions, which the government can take forward. Can we take this as the first 100-day agenda of the next government? Can we all come together and sort out our issues? My health, my right is definitely a very important domain for the citizens of the country. But having been closely associated with nurse profession, it is also important that the right and health of nurses are also heard. I'm being a bit frank today, and I thought I should put across these as my personal views. I'm putting this to you because the government is very sensitive with the cause of nurses. They've done so much. The will is there. I think if we lose this opportunity, it will be great loss to the whole profession as a whole. With these few words, I'd like to thank you again for giving me this opportunity and look forward for the interactions. Thank you so very much. Jai Hind.
Thank you, sir, so much for making us aware of all the fundamental as well as and the nursing perspectives also. Thank you so much, sir, for joining us. And I request now Dr. Lieutenant Colonel Dr. Sarvajit Kaur, the Secretary of Indian Nursing Council. Madam is from the Ministry Nursing Service Officer of 1996 batch. She has completed BSc Nursing from AMC Pune in 1997 and MSc from PGI Chandigarh. And she also has a doctorate degree from Punjab University. She has 25 years of experience of UG/PG teaching and administration, and she's decorated with 2 GOCC commendation cards and 1 Chief of Army Staff commendation. She's now, as you all know, she's a Secretary of Indian Nursing Council. Now, I request you, madam, to please address the participant with the subtopic as health as fundamental right, but in the nursing perspectives. Thank you so much, ma'am. Over to you, madam.
Thank you so much, Bharti. And I'm wishing all the nursing fraternity and the others who've joined us a very, very happy World Health Day. This day comes every year and brings with it a lot of motivation for all the health professionals to work together. This being Sunday, we are really very thankful to all who have taken out time, this being an off for most of us, the working professionals, really look forward. But at the same time, we are so very happy that you've taken out time to be with us. I'll be just sharing a screen. There's a small presentation that I have. And I'll be sharing views on my health, my right. Before I go ahead into the actual topic to share the views, I'd like to share a very small film. Just give me a second, please. Are you able to see this?
Yes, ma'am, but if you can make a slideshow out of it? Ma'am, we're not able to see the film.
Oh, I'm so sorry. I'll stop share and share again. Just give me a second, please.
Ma'am, you're muted and we're not able to see the
I'll try again. Technology, Bharti, so we're also just learning.
Click on it and then share screen on it, ma'am.
Yes, that's what I'm doing. Is it visible now?
Yes, ma'am.
Okay, so I'll play it and put it on maximum.
Ma'am, I think that is muted. We can't hear anything.
Okay, just to see. Are you able to see?
Yes, ma'am.
Okay. As we could see, My health, my right, the theme for this year that has been brought out by WHO actually resonates with the current scenarios that's happening around the world. Is my screen visible?
Yes, ma'am.
Thank you.
Make it full screen, ma'am. Yeah,
Yes.
thank you.
Is it visible now?
Yes, ma'am.
As Brigadier Venkat Narayan very rightly brought out, the day the nurses step into this field of nursing, we are taught the importance of health and how health is a fundamental right. We all are aware of this definition of WHO, which states that health is a state of complete physical, mental, and social well being, and not merely the absence of a disease or infirmity. This definition has undergone changes with changing times, but still brings about how various factors come into an interplay to define health. And this enjoyment of highest attainable standard of health is a fundamental right of every human being without distinction of race or religion or political belief, economic or social conditions. But take a look at the TV or the newspapers, we see what a challenge it is becoming every day. Around the world, the right to health of millions is coming under threat. It's causing the conflicts are causing death, pain, psychological distress. There are diseases, disasters that are causing disabilities and death news in every single page of the paper that we hear. On the other hand, there is rapid urbanization and industrialization. The climate crisis is another very, very big challenge that's, taking away even our basic right to breathe clean air or drink clean water. We have data that the indoor and the outdoor air pollution is becoming deadly. The WHO Council on Economics of Health for All has found that at least there are 140 countries that recognize health as a human right. And in India also, we recognize the importance of right to health, not directly but indirectly as a fundamental right. There are at least 4.5 billion people, that is more than half the world, that still lacks the essential healthcare as in 2021. Going back to the the foundation of health that we know through the Alma Ata Declaration, it states that health is a fundamental right, and the attainment of this highest possibility of level of health, it has to be a worldwide social goal. It cannot be, crossed by boundaries or by regions. Also, like the film just brought out, there are a lot many social and economic factors which contribute to this health sector. And we have to recognize that there are gross inequalities in the health status of the people. So, in this background, the theme of My Right, My Health has been chosen to champion the right of everyone, wherever we are, for our access to quality health services, education, information, drinking water, clean air, good nutrition, quality housing, decent working conditions, and freedom from discrimination. In between of all this, as a very important pillar of our healthcare are the nurses. We have been advocating right of health right from the day I think a nursing student steps into nursing. We place the patient's health at the core of nursing care and become the advocates of preventive, promotive, curative, and rehabilitative health. Most of the nurses will agree to this, that this parameter is not only restricted to our professional life, even in our personal life. Because of nursing, we get into this grid of teaching each and everybody who come into our lives how important it is to take care of health. Nurses, they understand and make their patients and caregivers also realize that people have a right and a duty to participate individually as well as collectively in the planning and implementation of the healthcare. So nurses, we play a very, very important role in translating these health policies and the international policies into actual doable targets for our patients, for their caregivers, and for the community around us. And we also actively bring out the cooperation of the community for the improvement of the health of the people. As Sir has brought out, as primary health caregivers, nurses are the first level of contact with individuals, families, and communities within the health system and bring this healthcare as close as possible to where the people live. We bring health right up to the doorstep of the people, making them realize how it is their right and a very essential part of their being. So nurses form a vital link for continuing healthcare process, be it moving from curative to rehabilitative care or from primary to secondary or tertiary care. Indian Nursing Council also gives a lot of focus on nurses' health. For all those of us who are working in the colleges and the schools of nursing will realize that having a good health is a prerequisite for admission into nursing, where it's very clearly mentioned that admission is subject to a medical examination. So we want our nurses, our nursing students to be healthy, and also we emphasize on the health of the nurses. The nursing curriculum. In the first year, every nursing student gets, oriented to health as a fundamental right. It's very much a part of our curriculum. All nursing programs, be it A&M, GNM, BSc, this concept, this knowledge acquisition is there. And of course, through the years, the competency building also focuses overall around health. Nurses also as a part of health team realize the importance of health for self and for our families. And there are a lot of institutional policies which the nurses contribute as a part of the health team or in whichever area they work to improve this health, be it, for example, the post exposure prophylaxis or the immunization protocols, all within the national health guidelines. So nurses contribute to the health of societies that they live in and the communities they reach out to. I'll here like to bring out the example of COVID. I know that most of the nurses, wherever they were staying, the communities, maybe the small areas, where they had to reach to, they advocated this right and how important it is for people to take care, be aware of what needs to be done, what does not need to be done, and how to bring about this right to health, this concept. Also, social participation, we realize it happens when individuals and communities, they meaningfully involve in decision making around health. And nurses play a very important role in this. Here, we'd also like to tell our nurses that it is their right to make decisions about their own health and protect their health as a basic human right by advocating, demanding action wherever they are working. Brigadier Venkat Narayan also has tried to bring out this point by telling that this is the time for us to be together for advocating the right thing to keep, health at the center of everything. And also to organize our communities to bring about a dialogue so that we can see what needs to be changed and how to do it. It's important for us to know our health rights, be it safe and quality care without discrimination, privacy and confidentiality of the health information, informed consent, information on treatment, autonomy, and integrity. So as nurses, we have a right to health, and health is a basic human right. I'll stop sharing and request that in case there are any questions, that could be just noted down in the chat box, or we could take it in the end of the session. Thank you. Over to you, Bharti.
Thank you, ma'am, to let us know, the nurses, what is our perspective, what is our right also. It's not only taking care of the patient, but also to look after ourselves first. Then only you can help the patients. Thank you, ma'am. Thank you so much. And now I request our President, Dr. T. Tilakma, Indian Nursing Council, and ex-nursing advisor for Government of India and recipient of Princess Sri Nagarendra Award 2023, who has a very long-standing experience in nursing, around 43 years. Now I request Sir to give the remarks for our participants. Thank you. So over to you, sir.
Good afternoon. Am I audible?
Yes, sir.
Greetings from Indian Nursing Council to all the nursing fraternity in India and abroad. This is a very important day for the nursing fraternity, World Health Day. I think many of the nursing students might be organizing different activities on the World Health Day. I myself recollect while I was a student in general nursing and midwifery, how my faculty was asking us to take initiatives on the organizing, educating the communities, and also at the public health in the community health nursing. So this is a very important day for the nursing fraternity. I am very happy our chief guest was able to articulate the some of the issues and challenges with the nursing fraternity is facing, and one mantra which was given by him is very apt, which I think I was articulating this same thing in my different in the different level. See the World Health Day, and we especially we have to how Dr. Tedros was able to make a big remark at the World Health Assembly and in different platform, which he has always made a big noise about the nurses. In the sense, if no nurses are there, you cannot achieve the universal health coverage. That is the mantra which I think he has spoken. That itself, the World Health 2020, the World Health Assembly, which represents about 190 countries, where the 190 countries health secretaries, the ministers, and the DGs, generally they go to the World Health Assembly in Geneva in the month of May. And such a very important assembly, they were able to pass with the leadership of the Tedros, and the International Council for Nurses collaborated with the World Health Organization, where the chief nurse position was lying vacant at the global level. See, the reason why I want to bring it this point is one of the issue which the nursing fraternity is facing of not filling up the positions, and generally, if anybody raises the issues with the stakeholders, the important stark reply we receive is financial constraint. So this financial constraint could be felt at the level of the in the WHO. Since I very closely worked as a global advisory committee on nursing and midwifery, where 13 people were the members of this committee, which I closely worked in the World Health Organization, and I got this reply that this financial constraint is available for the nursing fraternity at the global level. And the Tedros was courageous enough to fill that post of the chief nursing officer, the chief scientist in nursing in WHO, and she was able to take forward the state of the world nursing report, and also passing the strategic direction for nursing and midwifery 21-25, the resolutions. And what our chief guest mentioning about the issues and challenges we nurses are facing are put it in those four themes in those resolutions. The one of the important, the first theme, you all know that I have told in n number of my speeches. Please access this strategic direction for nursing and midwifery resolutions, and please access the state of the world nursing report, which is available in our INC website, and the state of the midwifery report. So these reports, which has come in a very handy, and the WHO is focusing to all the countries, including India, to implement this resolution. The first theme is investment. So the WHO is telling to all the countries, you have to, if at all, if you have to achieve the universal health coverage, you have to invest the money for the nursing and nursing service and nursing education. So in this perspective, at least I'm very happy government of India was able to invest the money for sanctioning the 150 nursing colleges. That's about 1,500 crore money has been allocated in terms of the investment. But there is a lot of investment has to come from the state sector. Hardly we see the state government is allocating any plan money for the development of the nursing at the state level. So the second theme which has been reflected in this, the creation of the nursing position. I think this is a big challenge. If we have to provide a qualitative nursing services, either in the hospital or in the community, you have to have an optimum nurse patient ratio, which is being laid down in the respective countries. So this optimum nurse patient ratio, at least in India, we are very fond of quoting the staff inspection SIU norms. Still a long way to achieve this the norm, though the Ministry of Health took up this initiative of bringing as a resolution from the Central Council of Health CCHFW and circulating this SIU norm to all the states for implementation. Many of the states have felt that due to the financial constraint, we are not in a position to fill up the position. So that is the level. So therefore, this world report and the resolution is also focusing to the countries. Yes, if we have to provide the quality of the patient care, and also the safety of the patients, and we are the one of the advocates for the safety of the patients in the hospital and also in the community. Yesterday, I was participating in one of the deliberation in the International Patients Union. I think this is the one when we Indian Nursing Council sent the draft amendment of the act to the Ministry of Health. We clearly included a patient representative has to be there as one of the member of the Indian Nursing Council member. So I think it has come in a different format. I think at least in the new NNMC, they have also mentioned that as a patient advocate. So where we yesterday we were deliberating in that International Patient Union, I think they are the patients representatives are asking the ministry and the stakeholders they should have a important say in the policy making. So that's a very good development which is happening because the ultimately the patient's perception, patient needs, patient's expectations has to be kept in mind in our planning process. And also there are though in India, I think even at the community health center, right to the institution rights where the patient the at least elected representatives are the members of already are there, but still this International Patient Union was making a request to the for the policymakers. They should involve the patients in the policy making. So the theme which has been reflected is that the leadership. So it has been evidence is there that the nurses and midwives are holding in a key position at the unit level where they have to collaborate with the various discipline, various the health human resource. The nurses are in the forefront because they will be the leaders, and if they have to have a leadership skills, they will be able to collaborate and cooperate and see that their collaboration with appropriate leadership skills, the impact and outcome for the patients are going to be there. This is the evidence which has been found that the reason this they have reflected in this strategic direction for nursing and midwifery resolution, the leadership. In this perspective, at least no, the Indian Nursing Council has taken a lead of bringing the leadership for change, which is there by the International Council for Nurses, running in the 60 countries. So we were lagging behind. The only about 4 years back, the China implemented this leadership for change project, and we have also brought that leadership. Though COVID was obstacle to bring earlier, but with great difficulty we were able to. This is a very the branded ICN Leadership for Change program, which we were able to brought to India, and we have trained about 40 leaders from the different states. I think all the states have represented, and also the public and private sector has been represented, including the corporate sector. We see that these 40 leaders who have been trained are going to take up this task of training the various in the clinical and also in the community setting in the leadership skills so that they will be able to access and able to seize the change. How a simple example of a patient safety in the clinical, how some of the many a times a lot of investment might not be required to bring the changes. Ultimately, patient is going to get the benefit. So such a type of a simple leadership for change programs has been initiated in this, and this is going to be implemented all over India shortly. The last is very rightly our chief guest flagged this issue is service delivery, service working conditions. In working conditions, in terms of the various the maternity leave or child care leave, what our chief guest was mentioning, yes, this is a big challenge, and also the whatever the SIU norm, which has been at least in the government of India, giving a 93 day offs in a year, which is a very I think significant policy decision was taken by the government of India way back in when the nurses went on a strike, which was made as a policy, but only this benefit is given to the central government institutions. And you know the central government institutions are very few, and large number of institutions are coming in the state sector. So this has not been implemented in many of the state governments. So these are the and again, if the nurses have to work effectively to provide it requires a lot of equipment, supplies, and the supervision for taking their action to improve the quality of the nursing. So these are the four important which has come as a strategic direction for nursing and midwifery. It is for us, as the chief guest was mentioning, it is for us for the various professional associations, interest groups are there for the nursing have to come together. I think even I, as an Indian Nursing Council, I made an attempt to bring this TNA and the All India Government Nurses Federation to a one platform to speak for one voice. That's where in the sixth pay commission when they submitted the to the in the pay commission, I think the principle of the World Health Organization how to attract, how to retain. That was the principle which was used by these two organizations when they submitted their demand to the pay commission. That's how the nurses could get a better initial pay scale. And now the nurses working in the government sector are highly paid compared to the nurses working in the private sector. Though the Supreme Court has come out in a big way of prescribing the minimum norms for the nurses working in the private sector, though the Ministry of Health has brought out the circular to all the state government to suggesting bring out this guideline as as a regulations. No state has not yet been passed, and also many of the interest groups, especially with medical representatives, with the due respect to the medical fraternity, they have approached the courts not to implement this the Supreme Court guided resolution of minimum salary in the private sector. That is the challenge which we as a nursing professionals have to face, and as our chief guest was telling that it is a very good opportunity where the Ministry of Health is willing to take a lot of reforms. As one of the big reforms which has been the Parliament has passed the NNMC, which is going to one of the very important component is to improve the quality of the nursing education. The recognition of the institution is brought from the state to the center. And also very important challenge which is the nursing and midwifery profession is facing a scope of practice, which is not there in the existing act, which has been brought into the new NNMC. So therefore, once like nurse practitioners, which we are already been approved by the Ministry of Health, and we have rolled out in the many of the institutions, and many of the intensivists have told me that this nurse practitioner critical care, which is being implemented in some of the institutions, they have come to handy during the COVID time. So therefore, there is an evidence which is available. We have to take forward not only with the critical care, nurse practitioner, midwives, where the midwives can contribute for the achieving the sustainable development goal, and also the other specialization. The one of the issue which the Indian Nursing Council is flagging to the Ministry of Health is creation of the position is going to make an attract for the takers of for these specialty programs, which I think the Ministry of Health is working on that, how to create the care restructuring, which is being done at the ministry level. Shortly, they are going to come out. So these are some of the initiatives as we as the nurses, we are very important for contribution of for the health for the patients. But at the same time, the right for the nurses, which the ICN is making a big plea at the World Health Assembly, how the nurses are treated in many of the countries, though the shortage which has been which has been flagged, global shortage is there, and nurses at least being a I think our the syllabus which is being appreciated by the developed countries like Brunswick University of Canada was able to recognize our latest competency-based BSc nursing curriculum. They have come forward and we have approved the 25 supernumerary seats to the Manipal, where they are getting a dual degree. Now, nurses of Manipal of 25 specialty who have been undergoing this course, there is no need for them to go to Canada to get the degree. They will be getting a dual degree. That speaks the volume of the curriculum, the competency-based curriculum, which has been implemented by the Indian Nursing Council with a focus on developing a national state-of-the-art simulation center which you develop and which has been appreciated by the global nursing and midwifery fraternity, including the ICN. They have not seen these type of state-of-the-art simulation center anywhere in the world. So we are now encouraging the medical colleges and the skill labs, and how the briefing and debriefing is going to make an impact in the learning process, which has been one of the focus in our training methodology. So this is a day which we have to remember, World Health Day, how World Health Organization is focusing for the whole health. And I think in my interaction, whatever I've seen, the WHO is focusing to all the countries, sensitizing. And even I think resolutions have been passed. Nurses need to be involved in the policy making. That's a big resolution which still many countries have not been implemented. At least India has been implemented, but states have not implemented. Our nursing organization at the state level is very weak. That is one of the reason which are not, though the under the NHM a lot of funds are allocated, but still we are not able to see the impact and outcome for the nursing outcomes. So, friends, I think yes, we are going to have a challenge, as chief guest mentioned. Is we all have to put up these things in a one voice, and that is that voice which I have always said. The All India Government Nurses Federation and the Trained Nurses Association of India. These are the big stakeholders, and we have a lot of other stakeholders. They should come together, speak with one voice, and we have a very good environment to get the impact. Wish you best of luck. Thank you very much.
Thank you so much, sir. Taking from WHO to Indian scenarios and why we are all working today. Now the platform is open for the everybody over here to ask the questions from Presence Secretary Madam, and Dr. Asha Sharma is also here with us today. So please, if any questions are there, please ask. I will unmute you. Or raise your hands, please. Any questions, please?
His brigadier is there?
No, sir. Sir has left.
Okay.
Oh, and Bharti,
Yes, ma'am.
it's not,
any chat, Bharti, some questions in the chat?
Ma'am, sir, just a second. Dr. Asha Sharma wants to say something. Yeah.
Okay.
sir, actually speaking, we have got those two very important reports on the WHO nursing and midwifery, and plus separately on the midwifery also, and for which the WHO has worked out the SDNM, strategic directions for nursing and midwifery. And I believe we have come to know that there was a subcommittee formed to take some actions on that. How will it be made applicable to nurses and midwives in India? So is that subcommittee in action? Is it formed, not formed, or formed but not doing anything right now? How can we get in touch with these people? Otherwise, we will not know. Ministry will keep saying that, yes, we are supporting nursing field and nursing fraternity, but we don't see so much in the outcome. And especially based on those two reports, which are including the very important three areas, education, leadership, and the service, how can we have those directions which are taken, recommended by the WHO, and how can we bring it, translate into action?
Madam, you know that I think we shared this issue which one member of parliament wrote a letter to the Ministry of Health, and they have informed that the committee has been informed. That committee has not been met. The committee has not been met. So there is not activity which is not going. But the fact of the matter, you also were one of the chairperson of the subcommittee. You know that a lot of catering,
Yeah.
a lot of discussions have gone in, maybe directly not in tune with those resolutions, but definitely the ministry is on the seized of the issue of improving the state of the nursing at the ministry level. Yes, we have to take up that issue separately. That because in my opinion, many of these resolutions need to be transferred to the state governments, because ultimately the states always look up to the center. So the state,
Yes.
I think there was somewhere some sort of a discussion which I think I am repeatedly raising the issue in different platform about that about committee, but but some or the other that's not coming out. But in other way, I think there you know that how much ministry is working on about the NNMC, and also the working for the care restructuring. So they are doing, but not necessarily. But those things what the ministry is doing, in a way, those four themes are reflected in that. So I think still we have to work on that for on those implementation.
Okay. Thank you.
Anybody else or participants would like to ask the questions to speakers, please? Today's speakers. You can unmute yourself and ask. Or if you're not able to, we'll unmute you, but you have to raise your hand, please, in the reactions. There's a reaction, there's a hand mark, so please put on that.
Bharti, I thought Mr. Shrikant Fulari
Mm-hmm.
wanted to make some comments. We could hear some comments coming from that side. Shrikant, is there anything that you would like to say?
Hello.
Yes, Shrikant, you can.
Yes, sir. Nothing else. Thank you. Thank you for giving all the messages. Happy birthday, madam. Okay, sir.
Your voice is not clear, Shrikant.
Yes, madam. Yes, madam. Yes, madam. Sorry. Sorry, madam. There is a network issue. Thank you.
Yeah, we
sir.
can hear you. Any question now?
Thank you. No, madam.
We can
No,
hear you
madam.
now.
Thank you. Sir. Thank you.
Okay, thanks.
Thank
Anybody else?
Shrikant wished us all a happy World Health Day, and this wishing the
Okay.
same to you. Back to you.
Right. So now I think if there are no questions, we are going to the end of the, yes, sir.
Anybody made in a chart, if any significant some inputs are there in the chart, if we can get those points, I think need be we can address those points which are right in the chat.
Yeah, so there's nothing in the chat box, sir.
Okay, there is nothing in the chat box.
Yes, sir.
So
So
we'll be
can we
placing
close
this.
it then?
We'll be placing this in the YouTube also by 1 o'clock. So in case we get any comments, we'll take them and reply them in the emails later on, if there's anything.
Okay, this is a message to all the participants. Please access this YouTube after 1 o'clock. And if you have any comments, please send those comments to the how, in what format they have to send, in a which email, or in a what is the system which is available
So
for
they
them.
can chat on the YouTube itself, so they can put on this thing and we can look into it later on.
So
We
in
can
the
give the comment on the
provision,
YouTube itself.
there is
Yes.
a provision in the
Yes.
YouTube itself, they can ask
Yes.
questions. So I think once YouTube, when you are releasing, please put at the end, if any questions are there, the participants, after going through the YouTube, they can put the question so that INC will be able to answer those questions.
Now I request DS, Madam Jyoti B, to please give the vote of thanks.
Yes, ma'am. Good morning to all of you, sir and madam. A warm good morning on this occasion of World Health Day 2024. INC extend warmest greetings and heartfelt gratitude to each and every one of you who have joined us with virtually to celebrate this important day. World Health Day is celebrated on April 7th each year, serving as an opportunity to raise awareness about health-related issues and advocate for improvements in global health. First and foremost, I would like to express our deepest appreciation to all the healthcare workers and frontline heroes who have been tirelessly battling the challenges posed by the global health crisis. Your selflessness, dedication, and unwavering commitment saving lives have been a source of inspiration for all. Thank you all for the healthcare professionals and frontline heroes. I would like to also extend our sincere thanks to our esteemed speaker of today, Brigade Dr. K.V. Venkatanarayana, Officer and Special Duty, Niti Ayog, have shared their valuable insights, experience, and expertise with us today. Your contributions have enriched and shed light on key issues pertaining to global health. Thank you, sir. A special word of gratitude to our highly respected President of INC, Dr. Dilip Kumar sir, who has generously supported us in organizing this virtual event. Your commitment to promoting health and well-being is our communities is truly commendable, sir. And we are grateful to your continued support, sir. Thank you, sir. I must also recognize the hard work and dedications of our esteemed officers, respected ma'am, Sarojit ma'am, and K.S. Bharti ma'am, in organizing this virtual webinar, worked behind the scene to ensure the smooth running of this virtual event. Thank you, both of you, ma'am. Thank you. And also I thank our senior EC member, INC, Dr. Asha Sharma madam also. And also I would like to thank principals and eminent nursing professionals for your participation and engagement in this virtual celebration of World Health Day. Your presence has made this event truly special and look forward to have continued collaborations in advancing the cause of global health. Thank you, all the nursing professionals. In closing, in the context of World Health Day 2024, we all need to focus on our health priorities. To get rich, never risk your health. Is the truth that health is the wealth of wealth. Self-care is not selfish. You cannot serve from an empty vessel. Be selfish in taking care of your health. And let us all strive towards a healthier world together. Thank you, ma'am. Thank you, sir. Thank you, Ananda. Over to ma'am. Thank you.
Thank you, ma'am. Thank you so much. I think we all celebrate a World Health Day in our way, in our own way of virtually celebrating it. Thank you all. So see you next year to celebrate the same World Health Day next year. Thank you very much. Thank you.
Thank you.
Thank you.
Thank you, everybody. Thank you.